Good afternoon.
Afternoon.
Hello. I'm Heike Jacobs, consultant neurologist from Germany, and I like to talk with you, Professor Nils, today about brain tumors. I know you have a lot of experience, 33 years, and you've been the chief of neurosurgery in Frankfurt and have also worked in other countries and know a lot about, or have done a lot of high-tech robotic brain surgery.
Right.
I myself have also over 20 years experience in neurology, and I have diagnosed quite a few brain tumors and have worked in teams who treated brain tumors. So that's what we want to discuss today. What is a brain tumor? What are the symptoms? How do we diagnose them and how do we treat them? So if you don't mind, I like to start to say a brain tumor is a conglomeration of cells in the brain or around the brain. It's usually cells which are out of order, which multiply and grow and are not controlled anymore. We don't know exactly how this happens. We think it is initiated through mutation in the DNA, where all the genetic information is in the cells. Am I right? What do you feel?
Yes, thank you very much, first of all, for the nice introduction. And we're working now together in Liv Hospital, and we established a neuroscience center, so we treat the patient together. And yeah, the brain tumor, it's a very interesting disease. Fortunately, the incidence, it's not so high. It's a rare disease. Yeah, for instance, we see 5 patients with brain tumors per 100,000 people. The same is in the adult and also for children. And the most of the brain tumors in adults are benign tumors. That means they're not cancer, around 60%. And the most challenging, of course, are the malignant tumors inside the brain.
Yeah.
And the benign tumors, they're coming from the dura and from the nerves. So this we can treat very well. We have a lot of treatment options.
Yeah.
And for the children, unfortunately, the most of the brain tumors in the children, they're malignant. But if we can detect them in the early stage, then even they have nowadays a good prognosis, and also the children we can heal.
Yeah. Also depends on the genetic profile now. The chemotherapies have become much more targeted. I just quickly want to, for our viewers, explain there are classifications saying there are good tumors and bad tumors, benign tumors and malignant tumors. The good ones, they usually grow very slowly and they only push on the brain. The aggressive ones, malignant ones, they eat away from the brain. These are the dangerous ones, and they are much more difficult to treat. There are other classifications. There's primary and secondary brain tumor, where the secondary is basically a metastasis from a primary cancer in the body. They are also quite common. I think if we talk about what patients need to think about, it's about risk profiles, and it's about symptoms to be able to diagnose a tumor very early.
Right.
To my knowledge, there is a risk profile for the really aggressive glioblastomas, more common in male, more common in Caucasian white people, and more common when you're over 50, and can cause a plethora of different symptoms.
I think we have to discuss about the so-called precision medicine. Everybody hear something about this, and precision medicine, especially we need in malignant brain tumors. That means always for malignant brain tumors we need a biopsy, or we have the biopsy. We can make it with stereotactic frameless procedure or during the microsurgical procedure, and then we can make an analysis of this special malignant tumor. We can see, we can make an investigation of the biology of this tumor, of the genetic codes of this tumor, and regarding the results, we can choose then, even with the help of artificial intelligence, the best treatment nowadays in the world. Because for the malignant brain tumors, the treatment, it's not only the surgery.
Exactly.
It's
Very common.
other treatments we need as well. We need, for instance, chemotherapy, we need radiation, we need radiosurgeries, and such kind of treatments to be successful also in these patients.
Yeah. So it needs to be a team approach to treat brain tumors. So, I mean, the way we diagnose here, we all see patients who have similar symptoms. It could be a seizure, could be a persistent headache, in particular in the mornings, could be a change of memory or personality, or just numbness on one side of the body. So we have seen all kinds of symptoms which led us to the diagnosis of a brain tumor. And then they get a thorough history and examination. We do an MRI scan and discuss what kind of tumor could it be and what is the approach here in the hospital. And then,
of course, absolutely right. When the patient are coming with some, I can say, normal symptoms like headache or a little bit stiffness in the neck, then we started with a diagnostic, with a physical examination and all of this diagnostic what we have. I remember one case, this patient around 50 years old came in my outpatient clinic with neck pain, with headache, cervicobrachialgia, and all of the things. And mainly we're thinking, okay, he has some problems in the cervical spine, like this degenerative disease. And then also in this case, I focused to the cervical spine, but additionally, regarding his headache in the occiput, I asked then for brain MRI, and it was a big surprise. This patient had then occipital malignant brain tumor. And so, of course, then we have to go in this direction to treat the brain tumor.
Prioritize there, yes. Yeah, neurology and neurosurgery, it's very fascinating. I mean, a brain tumor, depending on the location, can cause almost any symptom. If it's in the speech center, patients get word-finding problems, or there are memory difficulties. If it's more frontal, the personality can change, more irritable or, again, forgetful or apathic. So it's very, very important if someone has symptoms and they are persistent to come and get this checked, because as we talked about, it is so important to diagnose specifically and early to get the right tailored treatment. I thought we can also talk about the definition of tumors, like the good benign tumors and the relation to location.
Right.
Do you think all benign tumors are so benign?
Yeah, in the brain, of course, the benign tumors, not all of them benign, because it depends from the location, yeah. If you have benign tumors, for instance, meningioma on the hemisphere, it's easy for us nowadays to remove, and it's very safe, and the follow-ups are great. But if it's coming to some benign tumors on the skull base, then it's another thing. It can be compressed, even the brainstem and such kind of very sensitive structures. This is the most sensitive structure of what we have as a human. And so then you must be very careful with such kind of surgeries. Or nowadays we have more minimal invasive procedures to treat these benign tumors and very delicate areas. For instance, we have this so-called radiosurgery. That means it's not like a surgery. This is a radiation, but focused to the tumor. And then we can stop the growing of the tumor, and we can shrink the tumor as well. Yeah, this is a technology from Professor Lexell from Sweden. He developed this already 1970, but now we have more advanced machines. They started with a gamma knife. Yeah, this is a cobalt system, and nowadays the better one is, or more advanced, is a robotic system, a so-called cyberknife. And so with a cyberknife, we can treat such kind of tumors, especially when they're small. Yeah.
Yeah.
When the diameter it's more than 3 centimeters, then we have to think again regarding the surgery, and then the risk is higher. But if it's small, then we can treat such kinds of tumors really minimal invasive, very safe for the patient. And this is again what I demand, the early detection of the tumor. If the tumor is small, we can do a lot of things and very safety, and we can have a healing for the patient. The same is then also for the malignant tumors. We have to detect them in an early stage.
And I found it interesting when you mentioned artificial intelligence, and I totally agree that this will come more and more into play to form a treatment plan. And then in that flows everything, the histology, the behavior of the cells, its genetic profile, the location of the tumor, the symptoms of the patient, to find the optimized treatment plan. That's the future, to work with AI. Of
course, if you're talking about artificial intelligence, it's a very, very interesting topic, especially in the medical field. We can use the artificial intelligence already in the outpatient clinic. When the patient is coming for the assessment, for instance, the assessment of the patient can be done by artificial intelligence.
I agree.
So the artificial intelligence can ask the patient some questions, and in the end, only with this interview, we have 90% of the diagnosis. And then it's coming, of course, the physical investigation from our side, and then neuroelectrophysiological investigations, and then the radiology. And the radiology nowadays is very, very advanced, especially the MRI, and without and with contrast, MRI angiography, functional MRIs, and then we can make a brain mapping, then we see where is the area of interest, where's a tumor. The tumor is already in the near of the motor cortex or other eloquent areas, and then even we have a fiber tracking, so we see the fibers in the brain, and all of this we can integrate then in our treatment plan, also for the surgery. For the surgery, we use nowadays the navigation. That means during the surgery, under the microscope, we see all the images, and then even the brain mapping we see during the surgery to make it more safe. Of course, we have then also neuromonitoring
and
to see this online. For instance, motor function, speech area, or the visual function. And for all of this, we can use artificial intelligence. Also, we can use the artificial intelligence for the radiological diagnostic.
Fantastic, absolutely.
Also to see very, very small tumors. And we can use also the artificial intelligence for the treatment plan. Yeah, we can ask, what is the best treatment for these patients?
We just need to give in the
Because
right data.
we have a very big database, and in this database already millions of patients, and then we have then the results. What was the best treatment for this patient, or what we have to make in another way, and all of this we can use nowadays. Yeah. From the right diagnostic over the treatment plan during the treatment. Yeah? And this is not only for surgery, this is then also for radiosurgery, for medication, because we have also some tumors in the brain. It needs not a radiation, it needs not chemotherapy, it's not need surgery, only medication. For instance, for pituitary gland tumors. Yeah?
Absolutely, the hormonal producing tumors. Yes.
We can treat this very well with medication, and even we can try also the growth hormone active pituitary gland tumor to treat this with medication. Yeah.
And there we are at the symptoms again. This kind of tumor, it's a benign tumor. It's not aggressive, but it can grow very, very big. And it can compress the optic nerve or the chiasm where the optic nerve crosses into the brain. And we've seen that. Mild symptoms, visual field defects, patient ignoring, tumor growing. So we need to take this more serious and tell the patients, if you have a persistent neurological problem, affecting your vision, your speech, your memory, get checked before it is too late or before it becomes much, much more difficult. That's my opinion. And all my patients who have just a touch of visual problem, I send also to our ophthalmologist to get this really precisely investigated with visual field examinations, retina scanning. We send them to our endocrinologist to check the hormone profile in the case of pituitary tumors, or in the case when a patient has tinnitus, hearing problems, balance problems. We suspect usually an acousticus neuroma, which is also a nerve sheath tumor. So we can also, we involve a little bit our colleagues and educate our colleagues to find the brain tumors. What's your experience there?
Yeah, absolutely right, because the symptoms not so typically. Yeah, this is general symptoms what we see in brain tumors. Yeah, this is a little bit headache, dizziness, tinnitus, or sometimes when it's coming to numbness, then it's more specific. Yeah, or if the patient has a seizure. Yeah, then even all of our colleagues, they're thinking then in this direction. But with this mild or more
subtle symptoms,
moderate symptoms, then they say, okay, you can take a little bit Panadol or such kind of medication, and then it will be getting better. Yeah, and so for such kind of symptoms, we should be very careful, and there should be the awareness that it can be a serious disease behind.
Exactly.
Yeah, but nobody knows. Yeah, and so now what we have in healthcare is the checkup. Yeah, with the checkup we can see a lot of diseases. Yeah, but the health checkup normally not include brain scanning. Yeah,
you're right.
If you want to do this, then you have to take again an MRI with artificial intelligence, and you can make a body-brain MRI. Or not a body-brain MRI, you can make a body MRI including the brain and the whole body. And then you have the artificial intelligence, and this intelligence can say you, there is a small lesion, not only in the brain, in the whole body, and then you can start to make further investigations in this direction. And maybe this is the future, but of course it's also expensive, yeah? If you want to go for whole body MRI, maybe you have to pay 8,000 dirham or 10,000 dirham. And normally it's not covered by the insurance company. But such centers already exist, and this development came from USA. They have already big centers there, but of course everything it's private and mostly self-payment. But then you can make a really very nice checkup, and you can not only detect brain tumors, you can detect tumors in the whole body, or vascular diseases. Yeah. Now we are speaking only about brain tumors, but we have in the brain also aneurysm and other vascular malformations, and all of this you can detect. And if you have something, and if you detect this in the early stage, then the treatment options nowadays very, very good.
The chances are much higher for a longer life with a good life quality. Yeah. To close this up, I wanted a little bit to talk about what happens after the surgery, radiation, chemotherapy. There are patients who are left with some deficits like speech problems, neuropsychological problems, often seizures, symptomatic epilepsy. So this is something we as neurologists then take care of. We see the patients regularly, we send them to psychologists, we optimize the medication for their seizures, and we give support to the family and talk with them about the future, sometimes about palliative care if it is an aggressive tumor. But all around, I think it is a field. It sounds sometimes for people depressing, but I never found it like this. I had really rich experiences with the patients, and I really liked to look after them. I don't know what's your experience, but it's...
With this new technologies in the treatment, what we have in the operating theater, we have not only microsurgical procedures, we have also endoscopic procedures, so we can perform nowadays such kind of surgeries more minimal invasive than before. So with this, we have very good outcomes. Yeah, it's not like 30 or 40 years ago. Yeah, when you have such kind of diagnosis, then you can expect complications or neurological deficit maybe in more than 50%. Yeah, nowadays our aim is to treat patients with brain tumors in such a way that after the surgery they're not getting worse. We want to optimize this, that after the surgery it's getting better. Yeah, and the optimum, of course, is then without a neurological deficit. Yeah, and also if the patient has some deficits even before the treatment, we have a good system of physiotherapy, of neurorehabilitation, of other kind of treatments to have an improvement. Yeah, and even in the future, it will be more for patients. We have biological treatments in the future. We will have stem cell treatments. We will have in the future electronic devices for the brain.
Like Elon Musk is now coming to Abu Dhabi, yeah.
from the USA and from other countries, from Europe and even from China and from Japan.
Do you think the brain chip devices will be used for brain tumor treatment? Maybe?
No, not for the brain tumor treatment, but if the patient has a neurological deficit, yeah, then we can treat the patient with such kind of chips, yeah, to take over the function of the brain which is damaged, yeah, and this is really a very good development because we know we have in the brain a regeneration, a potential.
Neuroplasticity,
but this is limited. This is really limited and takes not only months, sometimes years.
Yep.
And we cannot expect a full recovery. So we need other treatments. And these two ways are very promising.
It's like
the biological with stem cells and the digital with the brain chips. This development started already 30 years ago, to use the brain chip and to make a connection of this brain chip with the brain, to connect the brain with digital informations. And now we reach this stage that we can use this at least in clinical trials. And now I read in the news that in Abu Dhabi, in Cleveland Clinic, they started already with this Neuralink, or they want to start with clinical trials for special indications.
I've seen one video of a patient with ALS who was not able to speak anymore, and their chip activated the speech center. So that was very, very impressive. Yes, wow.
So in general, the development in the medical field is very fast.
Yeah.
And I expect in the next years a great development, also for the brain tumors, and in the medical, in the drug treatment, in biology, and in the digital treatment.
And in the diagnosis.
In the
the
diagnostic,
correct and fast.
And even the surgical treatment will be more advanced than nowadays. Nowadays we are really very advanced. We make high-tech surgeries only for brain, but we will improve this, And so there are also some comments from Bill Gates and from Elon Musk, for instance, that in 5 years, all of this kind of surgeries, also in the brain, will be done by robots. Not only by the skilled and talented neurosurgeons, and they will replace also me with a robot. We will see what happened in 5 years.
Yes. It was a fascinating talk. I really enjoyed this. Thank you so much, Professor Nils.
Thank you. Thank you very much, Dr. Heike Jacobs, for the moderation and all of this inputs. It was great.
Yeah.